Good day, fellow YouTubers. My name's Robert Drum, and I first want to apologize for my appearance for my first YouTube video. However, I just got home, had surgery for anterior cervical discectomy with fusion on discs C4, C5, C5, C6. I had this done 2 days ago, and I am home today. And everything went great. The reason I'm doing this video is before I had the surgery, I watched a number of videos that were already on YouTube by patients that had this procedure done. I thought they were extremely helpful in preparing me for what I was to expect going in, and I thought it would be a great idea to contribute to that and give my thoughts and impressions on what I went through. What I want to start off with is explaining this has been a very long procedure for me. It's been 7 years that I have been dealing with various pain until they figured out exactly what the problem was. It started out for me, I was 39 at the time. I was having pretty severe chest pain in my upper back and neck area radiating down my arm. Now, initially, they did a lot of testing for cardiac issues. I did have a small hiatal hernia. They thought that might be the problem. They did tests for my gallbladder, pancreas. Ended up going to a gastroenterologist, having a bunch of tests done there with swallowing tests, and it was just a nightmare of tests. However, nobody had me go for an MRI to check anything to do with my spinal cord. And up until 2 months ago, when I went to my family doctor and again was back for the same thing, and explained that I'm having the numbness and pain in my right arm and in my neck, he finally said, you know what, we really need to get you an MRI. Thank God he did, and I'm going to show you the MRI in the video so you have a good idea what to look for and what it looks like when you have this type of problem. But I had very severe compression of those two discs, and surgery at that point was the only option. So it was a very long road, a very frustrating road. Nothing more frustrating than being in pain and doctors telling you, well, we don't know what's wrong with you. I felt like I was going crazy. I ended up on anxiety meds because I was very anxious and upset. You go through this pain, you don't know what the pain's coming from. So this is such a relief. At any rate, as far as the surgery goes, I am now almost 100% pain-free. The only pain that I do have is obviously from my incision. My throat is a little sore. Some of my neck muscles are a little sore because of the compensation, of my neck and it trying to keep my spine in place while the fusion heals. Now you'll notice I'm not wearing my brace at the moment. The doctor said I do not need to wear my brace when I'm sitting down as long as I maintain good posture. I should wear my brace, however, when I'm up walking around. I'm not allowed to drive in or ride in a car for several weeks until he sees me back, however. But otherwise, pain, I am in great shape. I would recommend 100% if you have pain, especially if you have pain in your arms, chest, upper back, neck, even going up into your head, numbness. Ask to have an MRI done of your spine, specifically in your cervical area. It is something that often is overlooked, but I'll tell you what, that's exactly what my problem was. The only downside, and this is just for my situation, this is not a common thing, because there was such a long period of time until they could figure out what the problem was. Right now, there was severe nerve damage in my left shoulder. I cannot move my left arm. I can pick my arm up and I can wiggle my fingers and I can move my wrist, but I have very, very weak grip, and I cannot lift my arm up on my own. If I lift my arm up and let go, it just drops. I don't have any strength to lift it up on my own. Has nothing to do with the procedure. It just has to do with the fact that the discs were that herniated that they caused nerve damage that's now preventing my arm from operating properly. Normally the surgery takes 2 to 3 hours. In my case it took 4.5 because of the extensive damage that was done. So that was something that's not usual for this case, but in my case it was. Now, one big concern I did have personally prior to going into the surgery was what was it going to be like after the surgery. Well, as you can see, I'm 2 days out. My surgery did last 4.5 hours. I was started at 8 o'clock. I was in my room in the hospital yesterday by 2:30 or Wednesday by 2:30, which was the day before yesterday, and they asked me what I wanted for dinner. Said I could have anything I wanted. Was able to eat a steak dinner. I had mashed sweet potatoes, peas, carrot cake, no problems eating. Some people complain of problems with swallowing in their throat. I didn't have any of that. The big thing though you are going to worry about when you come home is pain management. Now, they initially sent me home with Valium and Vicodin. In the hospital I was getting 10-325 Vicodin, which is a little bit stronger version. They sent me home with the 10-500. Now, since I've gotten home, the 10-500 wasn't quite enough to cover it. So I called my doctor, and he said, hey, take 2, get yourself back up to what you were taking in the hospital until you feel comfortable dropping it down. Don't be afraid to ask if you have a problem with your pain medication. You definitely want to manage your pain. But I will say this, the procedure itself, do not be afraid. If you're having this type of pain and they feel you need to have this type of surgery, I would 100% recommend it. Do not put it off, or you may end up in a situation like I did, where you end up with some permanent damage that may or may not be fixable. I will do an update and let you know how the strength in my arm is. We're hoping that with therapy I may be able to regain use of my arm, although until the bones in my neck fuse I really can't do anything therapy-wise to my arm or elbow. I can work my fingers, and I'm going to be doing some work on that, but it takes 6 to 12 months for these neck bones to fuse, and I can't be doing anything with this until this is taken care of. So the longer you wait, the more chance you have of other complications. At any rate, I hope you enjoyed this video. If you have any questions, concerns, please feel free to post a comment and I'll be glad to get back with you. Have a wonderful day.